Welcome back for Part 2, Year 2 of the Residency Program. Year 2 of the Residency Program continues with many of the same equipment, principles, and procedures, such as the arc check, portal dosimetry, and rapid arc on TrueBeam, as well as SRS capabilities at the Joplin facility. Joplin also uses Eclipse, but its R&V interface is ARIA instead of Mosaic. The resident will start to gain independence in numerous types of routine tasks throughout the course of the second year. Year 2 is mainly in Joplin, Missouri at the Cornell Beshore Cancer Institute. In 2015, the Cornell and Beshore families gave $3 million to Freeman toward the purchase of cancer treatment equipment. This money was used for a TrueBeam linear accelerator at the Freeman East Hospital. Freeman's Cornell Beshore Cancer Institute brings together the many services necessary to provide comprehensive care for patients and families dealing with cancer. Our supportive team uses the most advanced technology available to treat and overcome cancer, so you can rest assured that you or your loved one is in good hands. The program members at Freeman East are Chance Matheson, Medical Director of Radiation Oncology, Peter Situ, the Program Director of the Medical Physics Residency, Jeff Goodrich, a Program Mentor in the Medical Physics Residency, and Benjamin Blair, the Director of the Oncology Service Line. A significant portion of the residency is dedicated to clinical training. In Year 2, the foundation of external beam treatment planning and linear accelerator experience is used to add complementary skills with brachytherapy and unsealed radionuclides. Imaging will be studied in its own right as it pertains to the process of radiation oncology planning and treatment delivery. High-dose, high-conformity treatment planning and verification for modern stereotactic procedures will be explored thoroughly. And the program closes with 3 months focused on shielding of accelerators and radionuclides in radiation oncology facilities. The resident will also be involved in regulatory oversight processes and committees. The rotations of Year 2 of the program are brachytherapy and radionuclides, imaging used in radiation oncology, stereotactic treatment and planning, and shielding in radiation oncology facilities. Freeman Hospital East also uses lap lasers for virtual simulation and isocenter placement. The CT simulator also uses Varian's RGSC for 4D CT simulation. One difference between St. Francis and Joplin is that nearly every patient receives a PET scan as part of their simulation, whether or not they're used to delineate the target volume. The role of positron emission tomography in radiation treatment planning is expanding and introduces the use of precision medicine into radiation therapy. PET imaging provides a number of benefits to radiotherapy planning, including improved identification and delineation of the radiation targets from the normal tissue, automation of target delineation, reduction of intra and inter-observer variability, and identification of areas at high risk for treatment failure, which may benefit from dose intensification. In order to exploit these benefits, providers must understand that the PET-CT technology is available to them, along with the techniques of how to properly co-register and integrate the structural and functional information they contain. Freeman uses MIM image registration, multimodality registration. With MIM, you can register any number of diagnostic DICOM images, such as CT, MR, or PET-CTs, acquired in any native plane, axial, sagittal, or coronal, from any time point to the current planning image set. MIM has an empowered deformable registration. In addition to the excellent rigid registration, the deformable registration and correction tools are used to create accurate registrations across varied anatomies and patient placement, which would be impossible to do in other systems. MIM allows the creation of MIP, MIN-IP, and average CT creation, or mean CT creation. You can create derived images using the max, mean, and MIN-IP subroutines, regardless of the system used to bin the 4D CT data. Automatically create new MIP images based on gating decisions. Dose deformation and plan summing are the backbone of our adaptive radiation therapy program. Freeman East has a number of specialty procedures performed in the HDR vault. Additional equipment includes a BK medical ultrasound with transrectal probe, a floor stand stepper unit, and a Zephyr patient table for steady patient motion between imaging machines and treatment machines. Specialty procedures performed include the space or hydrogel placement and fiducial placement, as well as applicator placement under full anesthesia. Utilization of the BK template for HDR catheter placement and LDR seed placement is possible in our specialty room. Brachytherapy planning is occurring with the latest technology. Brachyvision provides a variety of dose optimization methods which may be used alone or in combination to obtain the optimal dose plan, such as adaptive volume optimization, AVOL, using the manual dose optimization dose shaper, which is a graphical interface, or using the adaptive volumetric optimization tool, which introduces options to the existing inverse planning to get an optimized plan that meets both the DVH objectives and the on-screen isodose distribution needs. High-dose rate prostate planning occurs in Vitesse multimodality planning, and Veriseed is used for ultrasound-based prostate and breast treatments. Veriseed is simple to use, straightforward structured, allows for real-time planning, allows for plan and implant on live images with the implant view, and has accurate needle tracking such that it can follow curved and angled needles to track individual seed locations. Veriseed made available to the Medical Physics Consulting Residency Program as a non-clinical educational tool by a generous gift from Varied Medical Systems. Additional hardware at Freeman Hospital East. The Verisource IX afterloader has attachments for the Tandem ring, the partial breast irradiation Savvy applicator, the standard vaginal cylinder and the universal multi-challenger Miami applicator, Leipzig skin cones, and adaptive custom applicators. Freeman East utilizes the 5mm Iridium 192 model in its Verisource IX. With a wide variety of applicators, we routinely treat intracavitary, partial breast, and surface HDR brachytherapy. And as a matter of completeness, Freeman also uses the Wellhofer BP1. I just had to put it in here somewhere. Radiochromic film dosimetry is considered a reliable technique for accurate dose assessment and quality checks in many applications of medical physics. Freeman East has verified Film QA Pro for use in comparing new modalities, machine annuals, and commissionings. Film QA Pro and the EBT3 program were very useful in the commissioning of the stereotactic cones, and the analysis service is offered to other facilities under Medical Physics Consulting's umbrella. During the entire second year, the resident will observe and participate in the hospital-wide radiation safety program, including shielding calculation reporting and surveys as time permits. Experience gained and afterloader use and radionuclides will be documented towards state or federal licensing requirements required of an authorized medical physicist. The resident is expected to prepare a license amendment for a hypothetical HDR program as part of the second year requirements. Well, that's it for the scheduled stops in the MPC residency program. During the second year of the program, the resident will have the opportunity to visit outside facilities specific to technologies not previously offered. Medical Physics Consulting has a long-standing contract with St. Francis in Cape Girardeau, Missouri. The facility has a CyberKnife VSI robotic radiosurgery system and uses MultiPlan for treatment planning in stereotactic treatment of highly conformal target volumes. Medical Physics Consulting has an affiliation agreement with Oklahoma Proton Center. Oklahoma Proton Center in Oklahoma City is a not-for-profit cancer center that was the earliest adopter of proton therapy in the state, opening in 2009 with an IBA cyclotron. The center has successfully treated thousands of patients from all over the United States and from 15 different countries. The doctors have experience treating patients with a wide variety of conditions, including breast, lung, prostate, head and neck, pediatric cancers, liver cancer, esophageal cancer, and many other diagnoses. The facility features 4 treatment rooms with advanced in-room imaging capabilities. Affiliation agreement has been signed as of June 2023. Another stop possible the second year is the Ellis Fischel Cancer Center. Medical Physics Consulting currently has an agreement moving through the legal channels in the administration at the University of Missouri for on-site review and training with the Varian Ethos Adaptive Radiotherapy Platform. We are excited to make this partnership a reality. To be continued. That concludes the virtual tour of the facilities and equipment for the Medical Physics Consulting Residency Program. Thank you and good day.